Before I ask about any specifics, what can you tell us about who qualifies for this?
Yeah, okay, so the idea of the additional public holiday both this year and next year is to recognise all workers because people in all different walks of life contribute to the pandemic effort, whether it's people working in supermarkets or in transport or in the healthcare service. But we do believe that there's a particular group of people, roughly 100,000 people, almost all frontline healthcare workers, who deserve particular recognition. And these are essentially staff who worked in clinical settings. They wore masks and gowns every day, and every day they were exposed to patients, not who might have COVID, but people who did have COVID, and did so for more than a year before there were vaccines. So these are almost entirely healthcare workers, but would include some other groups as well, the private nursing homes, the hospices, and does include, of course, people who work in a healthcare setting but may not be healthcare professionals, so would include, for example, the cleaners and porters and so on.
Okay. How long do they have had to have worked in those settings over the last 2 years to qualify?
I don't know the exact dates in front of me now, but it was you don't have to be working for a particular length of time. It's anyone who was working in those settings from the 1st of March 2020 onwards.
But they have to have worked continually. I mean, and I'm just thinking of somebody who did locum cover for a week for somebody else. I mean, are they getting €1,000, and the nurse who's worked continually for 2 years in those circumstances gets €1,000?
It's pro rata. So, for example, if somebody is a part-time worker working half-time, they'll get 500,000. If somebody only worked for a few weeks, they would get a reduced sum. So it is 1,000 based on working full-time.
Yeah, but if you're a full-time employee of the HSE, but you are only working for a very short time, but you work nonetheless in one of those settings, do you get the full €1,000?
You wouldn't. So let's say, for example, you were working in a clinical setting for a month and you were working in an office or working from home for 5 or 6 months, you wouldn't get the full amount. But there is going to be a panel that will adjudicate on some of these kind of grey areas and complicated cases, because they will arise. They will arise, of course.
Okay, because one of the other complicated cases is agency staff, and we had an example of somebody who answered the call as it was put out early in the pandemic to come home from abroad to work for the HSE, and ultimately when they applied they were sent to work for an agency. Now they worked in a frontline setting, but their understanding as an agency worker is that they won't be eligible.
Yeah, unfortunately you do have to draw the line somewhere, and we're drawing the line at people who were employed by the state. Wouldn't generally apply to people, for example, who worked in a private hospital or worked for a private company on behalf of the state. But in many cases those private companies have actually paid bonuses to staff already, and we'd encourage them to do so.
I mean, that seemed a little unfair.
There are going to be some grey areas, that is true, and that's one of the reasons why we're going to have the
yeah, but I'm talking about somebody here working alongside, shoulder to shoulder every day with an employee of the HSE, but they're there as agency staff. I mean, it's the best really you can do is ask your employer to give you €1,000, and by the way, we'll tax it because it's more than 500.
It is possible. Well, no, it is possible that they could be covered. So, for example, where people were working in what are called Section 38 or Section 39 hospices, they will receive the full payment. Also, some people who were home carers on behalf of the HSE would receive the full payment as well. So, there will be cases where they receive the full payment, but there will be lots of grey areas as well, where over the course of the pandemic they might have done a few weeks in a clinical setting, a few weeks in an office, a few months not somewhere else, and that is where it does get a bit complicated.
What about somebody who was working frontline and they were putting themselves in harm's way day in, day out from March 2020, but they chose not to be vaccinated at the beginning of 2021 and were moved away from patient-facing roles? Will they have their €1,000 bonus reduced to reflect the time they weren't facing patients?
Yeah, again, a fair question, and these will all be individual cases. But the answer to that would be yes. They wouldn't receive the full bonus payment because there were prolonged periods where they weren't in a clinical setting. So presumably they were moved to an office or working from home, so they wouldn't receive it for that period.
You mentioned private hospital workers. I mean, if they pay heed to your call and they turn to their employers and say, listen, we want a €1,000 bonus as well, that bonus is taxable, isn't it?
It is, yes.
Could the government do anything on that front?
But what we're doing anyway is that we're going to make it tax-free, and we're going to make it exempt from PRSI and USC for
public workers.
Yeah, for the people who are going to.
So if you're working for the HSE and you were facing COVID patients every day, we're giving you €1,000 and it's completely tax-free. If you're working in a private hospital and had to face COVID patients every day, overspill from public hospitals on foot of a deal done with the state, we're not going to give you anything. Instead, we think your employer should give it to you, and by the way, we're going to take some of it back.
Well, I think private hospitals.
Mean-spirited, isn't it?
Well, I think private hospitals receive very, very lucrative contracts from the government for the services they provided, and it is up to them to provide the bonus to their staff. Many of them have already, and they can, of course, pay the tax for them. They can pay that is open to them to do that.
All right, but the state was their proxy employer, effectively, those private hospital workers, for the duration of those contracts. Is there not an argument that there's a responsibility on the state to pay them the €1,000 bonus?
Well, we wouldn't accept that we were their proxy employer, and that would bring on all sorts of other potential obligations like pension rights and indemnities and so on. So, we do, for lots of good reasons, not least protecting the Irish taxpayer, we do need to make a distinction between people who are actually employed by the government or a government agency with a contract with us and those who don't. Maybe that sounds a bit harsh, but I hope people would understand that there's very good reasons why we have to make that distinction.
We have lots of texts in about retail workers, and Breed Smith was making the argument for them. To a degree, you've answered the question already, at the draw line somewhere, and if they're working in the private sector, maybe their employers could help them out. But can I ask you specifically?
In the retail sector, a lot of employers have been very good and have paid. The supermarkets have paid bonuses to staff, and indeed one supermarket has agreed to a permanent 10% pay increase. So, I think we need to recognise the fact that actually a lot of employers, where they've been able to do so, have either given bonuses to staff or, in some cases, substantial pay increases that would be well beyond the 2% in the public service.
Family carers, we spoke to a family carer earlier, and Family Carers Ireland are calling for financial recognition as well, particularly, they say, given how many services were withdrawn during the pandemic as staff were diverted, and they themselves, the parents, and it's often the parents, had to dig into their own pockets to cover the cost of those services. Do they deserve recognition? And if not, why not?
They certainly do deserve recognition. The way we would like to do that is by proposals that are being developed at the moment by Minister Humphreys to give family carers access to the state contributory pension. Essentially, a family carer is somebody who, there are different groups of family carers, but they're generally people who are in receipt of the carer's allowance because they're not able to work, are not able to get regular employment because of their caring responsibilities, and as a result of that, they often don't qualify for the state contributory pension. So the thing we'd like to do for them is to set up a system whereby they can qualify for the state contributory pension. I think that would be appropriate recognition. But again, because they're not employees of the state, if we were to start paying €1,000 bonus to people looking after members of their own family, that would create, I think, real difficulties. So we think the best thing we can do for them is exceeding that long-standing demand and request from them that they be given access to the state contributory pension on a non-means tested basis.